Okay, Pasta. This is Steven, and what I want to talk about for a brief moment is antidepressants and sort of the stigma that is attached to um, taking antidepressants or prescription drugs that help people cope with depression. And I find it a bit hypocritical that people put that stigma on someone taking antidepressants because people, for the most part, don't seem to put a stigma on people smoking or drinking alcohol or, you know, those two definitely, like smoking cigarettes and drinking alcohol. I think that is pretty much accepted by society for the most part. I mean, there are laws in place that prohibits those activities, but if someone were to do those activities, then you wouldn't think of them as weird or strange for the most part. But and as well, even with illegal drug use, to an extent, it's even accepted by the mainstream. In fact, it seems more accepted as normal than taking antidepressants. Some people smoke marijuana. Some people do like crack or sniff cocaine. Um, Other people do ecstasy or Molly. You know, and to an extent, even those even that type of drug use is accepted, but for some reason people seem to have an issue when you if you take antidepressants, and I don't think that's right. um, if drug use like that can be accepted, which is you know many times outside of maybe marijuana very dangerous for your health, then how come something that would be ultimately good for your mental health would be you know seen as something strange or something that deserves to be stigmatized? Um, it doesn't seem fair or right. I think that maybe situations like that kind of prevents people from possibly seeking help for their depression or mental illness or what have you. Um, and that's a shame. Um, and for the record, I don't like, I don't really agree with much drug use in general. You know, whether it's smoking, taking prescription medication, drinking, even taking over-the-counter medication. I'm a bit like, yeah, not so much. But nevertheless, it is a part of our society. And when it comes to antidepressants, I don't think that, for me personally, if I was suffering from clinical depression, that probably wouldn't be my first choice. However, I do believe that if the person has gotten to a point where they are losing interest in life and possibly becoming, suicidal or homicidal or a combination of both, then they should definitely take antidepressants or some type of, you know, medication to deal with that. Um, but, ultimately, in extreme cases, I feel that antidepressants are necessary. Um, but nevertheless, I think people use recreational drugs and alcohol to sort of cope with their like not necessarily depression, but cope with certain incidents that happen in their life that are really stressful. And if they can do that without much stigma, then why can't someone take antidepressants without dealing with a stigma of it? That's all I got for now. Thanks for watching.